The honourable member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health. Yesterday, 2 family physicians leaving Digby published a letter explaining their reasons for relocating. In the letter, the 2 young doctors noted a lack of resources and physician burnout as major issues. In light of the physicians' imminent departure, Digby General Hospital staff received notice that some of the health services may need to be adjusted as the NSHA recruits replacement physicians. Mr. Speaker, can the minister identify which services will be adjusted and when they will be up and running again?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, the letter that was published by these 2 physicians does outline a number of the concerns that they've raised. I think by my reading of it, one of the significant things as well that was highlighted was the personal circumstances of the physicians, Mr. Speaker, and what role that plays when they're making their decision of where to practice. We heard loud and clear from physicians throughout the last election campaign, Mr. Speaker. That's why we've brought more flexibility to allow physicians the opportunity to practice within the province. We've established a pool, Mr. Speaker, for vacancies to ensure that primary care access and physician services can be provided where and when needed.
The honourable member for Cape Breton Centre.
The doctors leaving Digby suggested that attracting locums and physicians who have roots in Digby or the surrounding communities is key to retention and recruitment. However, even doctors who are rooted outside of Halifax are finding it impossible to stay. Dr. Monica Dutt of Sydney recently left for Ontario after trying and failing to find part-time general family medicine work in Cape Breton. Mr. Speaker, anyone who works in healthcare in Cape Breton can tell you when recruitment was in the hands of the former district health authorities, we didn't have this kind of problem. Mr. Speaker, will the minister admit that taking power away from local communities has worsened the healthcare crisis?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And no, I wouldn't. What I would like to note, though, Mr. Speaker, is that...
Order, please. The Honourable Minister of Health.
Thank you, Mr. Speaker. What I would note about the situation in Digby, and as the member noted, the important role of communities and maintaining attachments in communities like Digby. I'd like to acknowledge the work of my colleague, the member for Clare Digby. He's a member of a committee made up of municipal representatives from Nova Scotia Health Authority, very similar to the task force that's up in Cumberland County, working to highlight. I know my member has travelled with the committee to Sherbrooke, where there are a number of French members from the community in the region, to attract them back to their community, Mr. Speaker. I'd like to thank them, all those members in the community throughout the province, doing this kind of work to bring people back to their communities as part of the recruitment strategy.